In this video, we are going to talk about acute brain stroke and its treatment. What is meant by acute brain stroke? The word acute means something that is of sudden origin or something that started just now. And brain stroke is the condition where the brain is affected all of a sudden by two of the things that could happen. One is the blood supply to the brain is blocked due to a clot, or the blood vessel that is supplying the brain has burst, leading to a condition called hemorrhage. So brain stroke is typically a condition where the brain gets affected by a sudden occurrence of one of these two possibilities. The thrombus is a clot that could be formed elsewhere in the body or within the part of the brain itself, and it goes and completely blocks the blood vessel that supplies blood to a certain part of the brain. And that part of the brain suffers from lack of oxygen, and thereby it gets damaged within a period of time. So also, when a blood vessel supplying to the brain bursts due to excessive pressure, which usually happens in the case of a patient who has got a high blood pressure. It is also aggravated in patients who are diabetic and with old age and so on and so forth. There are several factors which predispose a person to getting a stroke. So when this sudden episode happens, the blood supply to the parts of the brain gets affected, and that results in damage to the brain, leading to the parts of the body that are affected by stroke getting into a stage of paralysis or inability to use those muscles, as well as sensory losses that can happen. Depending on the area of the brain that is affected, the manifestation of brain stroke would be different. If parts of the basal parts of the brain, like the thalamus, is affected, one could even have a respiratory failure and may be needed to undergo immediate ventilation in an artificial ventilator machine. So what needs to be done? First is the question of recognizing when somebody is getting a stroke. The common method is to look at the four things which are called as FAST. Look at the face. Ask the patient to smile and see if the smile is uniform, whether the face is drooping on one side or the other. If the face of the patient looks abnormal and is drooping on one side, that could be one of the signs that the patient is suffering from an acute stroke. The other one is called arm. Ask the patient to lift his arms. If the patient has difficulty on one side of the arm, in lifting one side of the arm, it is a sign that he could be suffering from stroke. And the third one is asking the patient to speak. If the patient is going through a stroke, he will have difficulty in speaking. Not in all cases, but it is very likely that the patient could stutter in the way he speaks. That is also a sign that the patient could be going through stroke. And when you see any of these three, the next one is to telephone the hospital. Call the hospital for an emergency and move the patient as early as possible to a hospital that has got a facility of neurological treatment. A hospital with a neurologist and the entire neurology department would be able to handle a patient best under these conditions. So the thing that everyone needs to know is to diagnose a patient who is getting through a stroke and immediately take him to a hospital that has got a facility of neurology. A neurologist has excellent medicines to treat this sort of condition. If the stroke is happening due to a clot in the brain, it could be handled very beautifully with drugs that are capable of dissolving the clots. They are administered as injection, and that can enable the clot to be completely dissolved, and the patient can recover 100% if it is in a certain area of the brain. In the other case of where the stroke is happening due to a hemorrhage, the patient would still have to be observed over a period of time, and in some cases, as deemed fit, the patient could be subjected to surgery to remove the blood that is accumulating due to the bleeding, and in some cases even to arrest the bleeding. That decision is very technical and would be taken up by the neurosurgeons in combination with the team of treating doctors who will decide what especially needs to be done for that patient. So, but the critical information is to know that whenever a patient is detected to be suffering from acute stroke, brain stroke, he needs to be taken to a hospital with a neurology facility in order to deal with them in the best possible manner. And that can give them the highest chance of survival and recovery. However, after the acute phase of the stroke is got over in a hospital, the patients who have not recovered completely, especially in the case of a hemorrhagic stroke or a stroke patient who is taken to the hospital much later after certain parts of the brain have already been damaged. They wouldn't recover completely from the treatment given in the hospital and would require further rehabilitation to be done through a specialized rehabilitation center. It is in that context that our hospital at AVN Arogya, we are able to offer a holistic rehabilitation technique integrating modern physiotherapy, occupational therapy, speech therapy, and the benefits of the Ayurvedic treatment comprising of neuro-rehabilitating medicines, herbal medicines, as well as Ayurvedic therapies, which can enhance the level of rehabilitation and hasten the process of rehabilitation as well. So soon after the acute phase is over, the treatment of the acute phase in an allopathic neurology center is over. Ideally, the patient can be transferred to a center which has got the holistic rehabilitation technique, which is what we offer at AVN Arogya.
Go here to subscribe.